The Nelson Mandela Children's Hospital in Johannesburg has launched a campaign, and this campaign is for children with congenital heart defects. To find out more about this, we're joined now by Professor Hopewell Ntsinjana, who is the Associate Professor as well as Head of Paediatric Cardiology at the hospital. Professor, a very good evening to you, and thank you for your time tonight. Now, when we talk of congenital heart defect, what specifically is that?
Good evening, Tammy, and good evening to your listeners. Before I start, I would just like to convey my condolences to the family of Zuma Remy. Even though I didn't know him personally, but I know that his legacy will live on. Thank you very much. And just to answer your question, so congenital heart defects are the most common defects occurring on children at birth. And these are the defects that affect either the structure of the heart itself or the pipes, which we call vessels that lead out of the heart to go to either the lungs or the rest of the body. And these children are born with this problem.
And how prevalent is this condition?
So, Tammy, we are talking about a very common condition. We're talking about 1 in every 100 children that are born will be born with some form of a congenital heart defect. But the severity ranges from the very mild to the most severe types of these conditions. And those that are very severe are about 25% of the total of these children affected by this condition.
You speak about severity of the condition. What are the symptoms that perhaps parents should look out for in their children?
So the children that we see, really, we see them from very early on, and a child can either have these symptoms from birth early, where the child will be born with some bluish tinge on the lips and on the fingernails, which is a sign that the oxygenation in the blood is not quite at the normal level. Or these kids can be born with lethargy and breathing difficulties where they struggle to breathe. And some of them really get exhausted when they try to feed. So this is a child who, when they're taking either breast milk or they are on a bottle, they can't finish the bottle as compared to their peers of the same age. They get really exhausted. Or some of them that present a little bit later can even present with what we call failure to thrive, which means these children won't grow appropriately or they won't catch up with normal growth appropriately as compared to other children of the same age. So when you start seeing all these things, this is the time that you need to seek some healthcare advice, either to your GP or to your primary health care clinic or to your nearest doctor or nearest hospital, really, so that they can refer you to the appropriate facility that has pediatric cardiologists to evaluate the child.
Do we know, Professor, the causes of this condition?
Interestingly, Tammy, the majority of these children, we don't know what the cause is in the majority of them. But there are some which are associated with genetic abnormalities or abnormalities of the genetic makeup, which is what we call chromosomes. So if you've got some defects or some abnormalities in your genes, you get certain types of these congenital heart defects. But some of these children, we can just tell by asking more history from the parents. So for instance, if a child is born and there's a strong family history of these congenital heart defects, the likelihood of subsequent children in that family getting a congenital heart defect is quite high. So that it raises our index of suspicion. And the other thing is, over and above that, sometimes if the mother has got certain conditions, for instance, the infants or babies that are born from parents who are diabetic, from a mother who's diabetic. So we usually screen those kids for congenital heart defects because the likelihood of a child born from a mother with a diabetic condition is higher than normal other normal children. And also certain medications you need, before you plan pregnancy, to consult your obstetrician or your doctor or nurse about what kind of medications that are a no-no when you're going to fall pregnant, because what happens is some of these medications can predispose a child to these congenital heart defects.
And what type of medications could these be? Can you give us some examples, perhaps?
So, for example, some of them are, say, the certain antidepressants, and actually for teenagers who've got acne, certain acne medication for a teenage mom can predispose a child to some forms of congenital heart defects. And actually, there's also some implicated environmental factors, even though there's still an ongoing research as to which ones those are, because you tend to find that children who reside in certain areas have got the higher prevalence of these conditions than other children. So the jury is really still out, but the majority of them, and we tell the parents this, that we just don't know what the cause are, but they still remain the most common cause of any defect that the children present with after.
It does sound like the causes are manifold, but is there anything that parents can do to prevent their children from getting the congenital heart disease?
So rather than seeking medical help when you're pregnant, because when you're there, you will be consulted about what medication you to use, and your child will be followed up. And in some instances, even though in some states, because you can't get, some of these children can be screened while there are still fetuses inside for some of these conditions. And early detection is the key, really. So that's why we advocate that present early. When you notice the symptoms that I've mentioned, present to the doctor early. And just avoid certain things. So no smoking, because smoking or alcohol, for instance, intake when you're pregnant, all these things that are a no-no generally during pregnancy still stand for congenital heart defects. You need to avoid those.
You spoke about early detection. How
Yes.
soon can this condition be detected? Can it be detected in fetal stage as well?
Yes, it can. So we in pregnant mothers, we do what is called fetal echocardiogram or echocardiography, where we look at the structure of the heart while the baby is still inside the womb, and that actually helps us to plan the delivery, so that the child is delivered at a facility where there is availability of personnel that can treat these kinds of children. So we can stay neutral, and we can advise the parents on certain measures to take depending on the severity of the condition of the heart of the child in utero. But we're still different or lagging behind as far as that is concerned compared to the first one. So because of just the shortage of personnel in our country, as compared to the first world, where every facility has experts in fetal echocardiogram. We do have snippets of such specialists here and there in our country, but they are mainly concentrated in the big metros.
And what is the oldest patient that you've diagnosed with congenital heart disease?
So that's a really interesting question, because with the advance in medical technology, previously this used to be a debilitating disease where children would die much younger. But what has happened now is these children live longer, they live near normal lives, and they just have to keep on with their follow-up at the medical facilities where they are at. And so we've got what is called adult congenital heart defects, where they present at adulthood. And it's usually those who've held mild types of conditions that present at a much later stage, because the critical ones present much earlier, and before at the end of the first year, they must have, or even the first month in some of them, they must have had some form of an intervention in order to be able to live some form of a life going forward.
Let's talk about your particular institution, the Nelson Mandela Children's Hospital. What type of help and support do you provide for parents who have children with this condition?
So I think, to me, this is a fairly new facility, and its inception, which was about 3 years ago, really has changed the landscape by increasing the platform of where some of these children can get help. So we've got a fully fledged department with both the cardiologist side, which includes myself, and the cardiothoracic surgical side, which includes my colleagues who operate in the operating theaters. And we also have got maybe the biggest number of ICUs in the country, where some of these children, post-operative or after the operation, have got to go to. So we increased the platform of where some of these children can attend. We are a referral center, and we do get referrals from the GPs, the pediatricians, and from the local facilities around ourselves, and actually from as far as the other provinces within our country. And we are able to screen all the babies that are referred to us from start when they get here, they get into what we call a cardiac clinic, where we will screen them in order to get the diagnosis of what type of a cardiac defect they have. And that helps us, and we sit together as a group and plan what type of a management does that particular child need going forward. So just like Madiba said, that you can judge the way the society behaves by the way they treat their children. And in this facility, there is no child who is turned away because of inability to pay for when they come for the screening for their heart defects. So as long as you've got your referral papers and your doctor or referring nurse or referring facility has spoken to us or given you a referral letter, we are able to help you. And we've practiced what is called the family-centered care, where we take the parents along the journey with the child so that they are included in the management of their children.
Now, apart from congenital heart disease, what are perhaps some of the more common ailments that children and infants suffer from that you find yourself treating at the hospital?
So this is a purely pediatric hospital, Tammy. And to me, this is great because there's only one other pediatric dedicated hospital in the country, which is the Red Cross Memorial Hospital in the Cape. And this is the second one. And to me, this means that children no longer have to wait in the queue with adults to get access to get diagnosed early with certain ailments. So we've got various departments in the hospital. So we've got cardiac, we've got nephrology, which is kidney diseases, and we've got the largest number of dialysis machines for children with kidney diseases. And we've got pediatric surgery, where we help children with surgical ailments that need an operation in a surgical theater. And we've got neurosurgery, which deals with children who've got neurological or brain problems that need operation in that aspect of life. And we are supported by various other departments like pharmacy, allied medical health with your physiotherapist and your occupational therapist, the radiology department, anesthesia department. So we run a full-fledged pediatric comprehensive care within the hospital that is able to cover various aspects of children's ailments.
Professor, before I let you go, I want to touch on this because, you know, tomorrow is Valentine's Day, but it's also a special day for you as the Nelson Mandela Children's Hospital. You've put a little bit of a spin on it. Tell us about the programs that you'll be running. Tell us about the hashtag campaign as well, and what it is that your call of action to parents as well as supporters is.
So this gets a smile on my face, as you can see. I'm really chuffed about this because this is something that has been going on in the international world or world-class facilities for a long time, which is crowdfunding. So we're really running two programs at the same time. So it's Wear Red campaign for the children with congenital heart disease. But in conjunction with that, we are running a crowdfunding campaign which says that give like as if it's yours campaign, which is a call to everybody out there to adopt this type of a slogan to fund as many children through donations to our website, where you can get all the information at Nelson Mandela Children's Hospital.org.za, and the details are there. But we're launching this campaign, which is going to go live on television, where we're showcasing the hospital and really sounding a call for all the South Africans who helped to build this facility. Now, the second call to them is, yes, we are very happy that you helped us to build this facility. But now we call upon you again to hold hands with us so that we can take hands with each other going forward to fund certain programs that are going on in the hospital. And there is no small amount of a donation that you can give, because whatever you put in, and there's children who are giving to schools, and there's adults who are giving, adopting kids or adopting the procedure, and even to going as far as big corporates. So we're calling upon all ordinary South Africans to take hands together and help with this hashtag, give like as if it's yours campaign. And we're calling upon everybody to give towards what we do here. And we can't wait to see the TV ad flighting into various audiovisual platforms in the country, which calls upon our nation to say, we build this facility. Now let's take hands to make sure that it works. Let's donate more to make sure that we can perform those difficult surgeries and difficult interventions that we do.
I must say, Professor, really amazing work that the hospital continues to do. Thank you so much for your time, as well as the in-depth information on all the various ailments that are treated at the Nelson Mandela Children's Hospital.